Welcome to Inside San Diego, where we take a personal look at the hottest trends under the sun. On today's show, we'll have the most San Diego has to offer in love, life, fashion, fitness, food, and all-around entertainment. Live from the studios at KUSI News, Inside San Diego.
When we come back on Inside San Diego, obesity. It is one of the most serious health problems in America, especially among children, teenagers. A growing number of young people are turning to gastric bypass surgery or stomach stapling to lose the weight. Dr. Alan Wittgrove is here with two of his patients to talk about their success stories and how it works. Plus, Prince fans in Minneapolis. Obesity, it's one of the most common and serious health problems in America, especially among children and teens. A growing number of young people are turning to gastric bypass surgery or stomach stapling to lose the weight. Angela Pimentel and Doris Cronkite both underwent the surgery, and they are here this morning with Dr. Alan Wittgrove, founder of Wittgrove Bariatric Center at Scripps Memorial Hospital. Welcome to all of you. Thanks for being here.
Thank you.
Dr. Wittgrove, I know that you made headlines years ago when Carney Wilson came out and had the gastric bypass surgery. She really kind of put a face on this procedure, and since then, so many people have had it. It's become quite common.
Right. The operation itself, gastric bypass, has been very common. There's probably 200,000 people that will have gastric bypass this year. The bad part of that is it's only about 1% of people that need it. So there's still a lot of people that suffer with morbid obesity and the diseases that go along with it.
Well, let's talk about what gastric bypass surgery is and who the best candidates are. We have some pictures of it being performed in the operating room. It's really a last resort for losing weight, isn't it?
Well, the problem is medical treatment doesn't work very well. And so last resort, hopefully it's the last resort so that they don't have to have anything else done.
Now we're looking at some pictures in the operating room. What does it entail, the procedure itself?
The operation is a major operation. It's done inside the abdomen. We change the routing of the small intestine and the stomach, so we make a very small stomach pouch so that people are restricted in what they can eat. The key is, with that rerouting, people also feel satisfied with a small amount of food.
Now, two of your patients are here today, Angela and Doris, and we were talking a little bit about how gastric bypass is becoming more common among younger people. It's being used. You look like a very young person, Angela. You lost a lot of weight through the procedure. Tell us, how old are you?
I'm 29.
You're 29, and you had the surgery how long ago?
Just about a year ago.
A year ago. Tell us about your experience.
Well, my kids were the reason they're the reason I did it. I wanted to be there for them. I wanted to be able to keep up with them. I had struggled with my weight all my life. It wasn't a long time, but I had always struggled with my weight, and it wasn't under control, and I wanted to wait. I didn't want to wait until I had no mobility. I knew it was coming. I knew it was something I needed to take care of now.
Wow. And the difference, we just saw the before picture. You lost how many pounds?
90 so far.
90 so far. And you had some health problems. You were borderline diabetic?
Yeah, and I had high blood pressure, and I had back problems, and I really wanted to make sure I was there for my kids. I have a 5- and a 7-year-old, so.
So in this case, it really can be life-saving, can it?
Oh, yeah. Absolutely. Life-saving and life-changing. So if you look at the main comorbidities, you know, even at age 28, she had hypertension. It's usually thought to be, you know, someone older that has that. Diabetes now we're seeing in even teenagers.
Right.
Because our teenagers are getting bigger and bigger and bigger.
Now, Doris, you also had the gastric bypass surgery. What was it like for you?
It gave me back my life. Gave me mobility, took away my high blood pressure right away, immediately, basically, and changed my life. Gave me the tool to give my life back to me.
And there's a picture of you before. You lost more than 100 pounds?
Yes, yes.
Wow. And so it's changed your life, and you're feeling better, and you are healthier?
Oh, absolutely. I lovingly say I'm 33 on each leg now.
Right.
Playing golf again, doing gardening, water skiing, everything.
And Angela, what about your eating habits? Once your stomach is just small, what do you eat like today? Are your habits what do you consider normal?
I eat 3 times a day. It's small amounts. I have to make sure I schedule it out and I think about it and I don't snack because, you know, it's a tool. You have to use it. I could gain the weight back if I didn't pay attention. So I have the tools and I have the knowledge in place to make sure that it stays off.
And Dr. Wittgrove, once you have gastric bypass, it stays forever, it lasts forever. How does that work?
It does stay forever. You know, the operation has to be done correctly. That's an important phase of it. And support groups are important, follow-up's important, so that people continue to use that tool the right way. There's no question.
And the diabetes link, people, this has been in the news lately, people who have type 2 diabetes who have gastric bypass, does it make the disease go away?
It does. If a person's had diabetes for less than 8 years, it looks like probably over 95% of people will have their diabetes go away within 2 days. There's some important link between what the duodenum does. The duodenum is the first part of the small intestine, and it makes anti-insulin factors. And so if you block those, then your diabetes goes away. And with food not going into that part of the small intestine, then those blocking agents don't form.
Wow, it is remarkable, and it's not for everybody, right? There are risks that people should know about.
There are certainly risks, absolutely, and I recommend that people look at our website, certainly, or come to one of the lectures to find out about those.
We're going to have all of that information on the KUSI website. Dr. Wittgrove, thank you so much. Ladies, Angela, Doris, thanks for sharing your story, and continued good health to both of you.
Thank you.
Good luck.
Thank you.
In health news today, it is getting easier for families of Alzheimer's patients to know where their loved ones are.